Yesterday we talked about constipation. Okay. Today we will discuss an important gastroenterology disease that is diarrhea. Okay. Diarrhea is an GID disorder. Okay. So GID disorder. So actually, what is meant by diarrhea? In the constipation, the stool pass very hardly. Okay. Here in the diarrhea, what will happen? The stool pass very frequently. Okay, frequently. The stool passes very frequently. The movement of bowel is very rapidly. Okay, so sometimes there is stool, sometimes undigested food. Okay, undigested food is there and particles. Okay, these can be seen in the diarrhea. And along with, we have abdominal pain. Okay, abdominal pain, nausea, vomiting, if it is severe. Okay. So basically, diarrhea it will occur mostly in while there is very coldness or very hotness in the temperature, mostly like in summer season. Okay, people like to drink cold water. Okay, or people like to eat drink cool drinks or food outside food. Okay, so this is the mostly due to the eating outside food or any due to the bacteria. Okay. So this is diarrhea, and we have one basic symptoms. Sometimes it is fatty. If not treated, if the all the body liquids are flushed to the stool, what will happen? In this condition, the patient BP will decrease. Okay, the BP blood pressure will decrease, pulse rate decreases. Okay, and the patient feel very lethargy or very weakness. Okay. In this condition, we can see the low BP, low blood pressure, or decrease pulse, or sometimes increase pulse rate. Okay. And we have lethargy or weakness, severe weakness. We need fluid replacement. Because the fluid is lost. Fluid is lost. Fluid is lost. So we need fluid replacement. Replacement. So in that, in the allopathy, they will try to give us fluids or saline or drips, okay, to replace the fluid. So I think it is necessary also, or in some cases, in the patient BP decrease, severe hypotension, because hypotension is very, very dangerous. Hypotension is very dangerous, and you have very uh, different types of clinical features you can see in the uh, Hypotension, the patient blood flow to the organs is decreased, mostly to the brain or kidney and later on other parts. So if the output to the kidney is decreased, if the input is decreased, then output also decrease. So kidney chances of brain stroke is more in this hypotension. Chances of kidney failure are more in hypotension. So chances of failure of organs are more in hypotension. So rather than hypertension is very dangerous. So less amount of fluid will cause dehydration. Dehydration cause hypotension. Hypotension leads to continuous hypotension leads to organ failure. So that's the reason we have to give the fluid replacement therapy. So what are the different types of reasons behind the diarrhea? Let's discuss that first, and after that we'll discuss what is the treatment in electron. Okay, so it is due to the direct involvement of stomach and or intestine, involvement of intestine or any uh, coronal bacteria, bacteria. Okay, and we have uh, cancer of rectum also cause diarrhea. Okay, and we have pancreatic problem. In the pancreatic problem, also patient have diarrhea or other causes, likely food due to the due to highly consumable of outside food, okay, or any infection. Okay, these are the causes can be in the due to the stomach, is the intestine, due to the coronal bacteria, with the cancer, pancreatic cause, or any outside food you consume. Okay, and due to the transport, the food is indigested, and the particles are irritating to the large intestine. Okay, the peristaltic movement is increased due to the irritation, and it is thrown away from the large intestine. Okay. In the diarrhea, what are the clinical features we can see? Let's see that for the clinical features. Already we studied that it is depend upon the severity. It is due to the bacteria or due to the food, due to the any other issues. Depending upon that, the diarrhea will. Sometimes patient will have more than 5 stools, watery stools. Okay. Sometimes more than 10 or more than 15. It is dangerous. More than 5 is dangerous. Okay. Along with that, the patient will have, if the infection is there in the large intestine, patient have fever. Okay, fever is symptom due to the infective diarrhea or headache. Like headache is also is there due to the fluid loss and body ache, muscle ache. Okay, and dry tongue. These are the common other symptoms you can see in the diarrhea along with loose stools. Will not go into more detail. I think it's much enough for us to understand about diarrhea. The peristaltic movement of the intestine is increased. What do we have? We have peristaltic movement. Peristaltic movement is the movement from the mouth or from the esophagus to the large intestine. The way it will continue happening in the small intestine, large intestine. Okay, small intestine. Okay. It's the wave. If you eat the food, it will go forward. If you have food for absorption, it will go forward. If you have stool, it will go forward. So whatever things are present in the alimentary canal, food canal, it is the food canal or alimentary canal or pipeline, it need to move forward. For the digestion, it needs to be needed to go forward. For the absorption, it need to be go forward. For the defecation, it need to go forward. Okay. So that's the reason peristaltic movement will happen. Sometimes it is very it's increased if it is 10 meter for 10 minutes. The pressure is 10 mm of Hg. It is, I think, is normal. Okay. Okay, after eating food, it will increase for digestion, absorption, or for deficit. In the diarrhea, what will happen? The 10 meters become 30 meters. In 10 minutes, this become 5 minutes. And the pressure it increases 10 to 30 mm. In the 5 minutes, the stool or anything will go forward, mostly stool, 30 meters in 5 minutes with a pressure of 30 mm of Hg. That's the reason diarrhea will have been getting sounds, vowel sounds. Okay, vowel sounds. Okay, so when we can hear with the syllable, we will notice that. So it is due to the pressure of the peristaltic movement. Other things I want to highlight here. Uh, Something what will happen in the diarrhea? Loss of fluid. These are the important things. Okay. Loss of fluid happen, hypotension. Okay, and due to the hypotension, we need to understand that hypotension or low BP, weakness. Sometimes the patient have back pain, low back ache. Why this happening? Because the fluid not in the body, in the bones also decreased. Because in the bone we have calcium, phosphorus, other minerals which makes the bone stronger. Along with that, we have water that need to be taken. So the water is decreased in the bone, so the bone strength will affected. Okay, this is also some clinical feature the patient will tell if the duration is more than 1 2 days. Line of treatment is basically first thing you have to fluid replacement is very important. Okay, it may be orally if the patient doesn't have nausea, vomiting, we give orally with ORS, ORS sachets available in the market, or you can make your own ORS with the help of salt, sugar, and sometimes lemon. Okay, this will decrease the dehydration. It will hydrate the body, and it maintain the heat. Okay, so replacement is very very important. Diet. Okay, so if the patient doesn't have nausea, vomiting, get cured orally. If sometimes then he need IV. Okay, IV fluid replacement therapy. So it is better to take higher doctor or any specialist doctor advice before giving fluid replacement therapy. In electropathy, what kind of medicines you can use? Basically, we have S1, S10, C10, okay, A1 also sometimes because of the one F1, F2, the F2 also. And in the electricity, initially W, then B, then G, and S5 also, and S last. So we have S1, W, S10, C10, W, all in D6 initially. We have to give rapid dose because to decrease the uh, effect of the disease, rapid disease, rapid dosage is required. Okay, in D6, direct on tongue, uh, for 10 minutes, 10 drops, every 10 minutes, 10 drops, first hour, second hour, 10 drops for every 20 minutes, third hour, 10 drops every 30 minutes. Likewise, the severity of disease decreases, the time period increases. It is uh, very important. Dose, rapid dose is very important. Both you can give. We have C15 also. C15 Y1Y, or directly you can use S10Y. Is very good. Okay. D6 rapid dose, and sometimes if it is the peristaltic movement is dependent upon the brain, so you need to control brain also. So you can use add F1, S5, W, or in the place of S5, you can use S10. So this is the dosage, the medicine, the remedy for controlling the peristaltic in the of the intestine. So with it from the brain. So these are the remedies. We have SLAS also. SLAS can also use in D6. If it is infective, if it is infective, you can use VAR1. You can use VAR1. So here already C15 VAR1 by okay. It is very good. can use in D6. All D6 make you condition. Okay, one medicine is rapid. On our two, you need S10, WE, F1, S10, WE. These two remedies may lead in rapid, and we need to, along with fluid replacement therapy, which will improve the condition of the patient. Okay. And the body will dehydrate slowly. Okay. Then you need to focus on the diet also. Don't give spicy food, oily food, non-veg, anything to stop eating meat, uh, liquid diet or semi-solid diet. Okay. In the diet, you need semi-solid diet or liquid diet. This will give gradually the strengthening to the body. Gradually increase BP, monitor BP, monitor pulse, monitor BP. If it is your home patient, you need to monitor BP, pulse rate, and sometimes sugar levels also, RBS, random blood sugar level. Okay, and you need to check, ask the patient about urine output, because if the fluid is decreased, hypotension will happen and the failure of organ will happen. So you need to check all these parameters. Okay, so I think I understood about the diarrhea. This is all about this class. Any questions then? Thank you.